First nerve that I checked was cranial nerve 1 olfactory. I was testing for smell. I asked patient to close one nostril and breathe through it, and then I repeated it with other. This can, if there is a congestion, this can cause anosmia. After that, I used non-irritating familiar substance. In this case, I used the coffee and cinnamon. Cranial nerve 2 optic. I was testing for visual acuity, visual field, and fundus exam. First of all, I checked for acuity. I gave my patient a visual acuity chart. I told him to hold it in a 14-inch distance, approximately half hand distance from their face or wherever they are comfortable reading it. Then I asked the patient to cover one eye with their palm and read. Then I asked them to close another eye and told them to read it from the other side. For cranial nerve 3, 4, and 6, oculomotor, trochlear, and abducent, I was using the H test. I stood in front of the patient and told him to follow my finger just by looking with the eyes, not moving his head. For fundus examination, I had the patient to focus on the distal wall behind my shoulder. Then I approached his eye from a 20-degree angle with my ophthalmoscope. I noted disc color and I was looking for any irregularities. For pupillary light reflex, I approached patient's eye with a pen light from one side and was checking the pupillary reflex. Then I quickly switched to the other eye. Cranial nerve 5 trigeminal, I was testing for facial sensation. I asked patient to close eyes. First, I touched the ophthalmic region on both sides, which is forehead. Then I checked the maxillary region. I touched the cheek and then the mandibular region. Then I checked the pain sensation with a blunt object. In this case, I used the hammer. I asked patient to put their hand over their leg while they're sitting. Then I asked patient to close their eyes and poke their face on the forehead, cheek, and jaw with a blunt object, and asked if they can feel sharp or dull pain when their eyes are closed. Checked the corneal reflex. I approached patient's eye with a cotton ball and looked for the bring reaction. For cranial nerve 7 facial, I was testing facial movements, both spontaneous and to command. I asked the patient to smile, then I asked the patient to show me their teeth. Then I asked patient to raise his eyebrows while keeping his head steady. Then I asked patient to close their eyes tightly and I tried opening them. Asking patient to puff out their cheeks and compared both sides. Cranial nerve 8 vestibulocochlear. I used the tuning fork test, concretely the Weber's test first. I hit my palm with the tuning fork and then I placed it on their mid-forehead. Then I asked if they can feel or hear the vibration in both ears. Second, I did the Rena test. I put the vibrating fork stem against their mastoid, and as soon as the sound is no longer heard by the patient, I move the fork to the ear and ask them if they still can hear it. Cranial nerve 9 and 10, glossopharyngeal and vagus. I was testing for palate movement, pharyngeal sensation, voice, and swallowing. I asked patient to say ah and was looking inside of their mouth with a light and was checking for the posterior palate moves medially and the uvula is in midline. Cranial nerve 11 accessory. I was testing the shrugging of shoulders and turning the head against the resistance. First, I placed my hand on patient's cheek and asked them to turn their head against the resistance of my hand, and I noted the strength and also checked the muscle with my opposite hand. Then I did it the same on the opposite side. Next, I placed my hands on the patient's shoulders and asked them to shrug their shoulders. I noted the symmetry and the strength. Cranial nerve 12 hypoglossal. I was testing tongue position and movements. First, I asked patients to stick out the tongue and was looking for any fasciculations. After that, I asked patient to conduct movement from side to side and checked for any deviation of fasciculation. Last, I checked the patient's strength in the tongue. For muscle tone, which is muscle tension at rest, I assessed it by pressing movements. I asked the patient to relax and I tried flexing and extending the patient's wrists, elbows, fingers, ankles, and knees, big toe, and I was feeling for rigidity or spasticity. We did the forearm flexion. I asked the patient to keep his arm flexed. Then I asked the patient to pull his arm towards him while I attempted to pull it back. I compared on both sides. After that, I asked the patient to flex his arm again. I checked for forearm extension. I asked patients to extend the arm while I was pushing against him. Then I checked the wrist extension power. I asked the patient to make fist and move it down while I pushed it up. Then I did the same with the wrist flexion tightly and tried to move my fingers. After that, I did a finger abduction test. I asked the patient to extend the palm down and asked to spread the fingers while I was trying to bring them together. After that, I did a thumb opposition. Now I asked them to touch the base of their pinky with their thumb, and I was trying to pull it. For the lower extremity, I did the same tests. First of all, I did the hip flexion. I asked the patient to raise their leg in the air, and I placed my hand on the thigh. I asked the patient to raise the thigh against the hand resistance. For hip extension, I asked the patient to raise the leg in the air, and I put my hand under it, and I tried pushing it up, and while he was trying to pushing it down. Next, for the hip abduction, I placed my hands medial over the knee and asked the patient to bring the leg together against the hand resistance. I did the same for the hip abduction. I placed my hands laterally on the side of the knees and told the patient to push out. After that, I did the knee flexion. I asked the patient to bend the knee and tried pulling their leg while I will be pressing foot down. After that, I did the knee extension. After that, I tried the dorsiflexion of the lower feet and asked the patient to pull the toes up. After that, I finished with the plantar flexion. Reflex testing, I used the hammer. I told the patient to relax. First of all, I used the biceps reflex. I placed my thumb on the bicep tendon. I strike my thumb with a reflex hammer and elbow and contraction of biceps. After that, I did the brachioradialis reflex. I strike the brachioradialis tendon directly with a hammer when the patient's arm is resting. There should be flexion and supination of the forearm. Then I check the triceps reflex. I stroke the triceps tendon directly with a hammer while holding the patient's arm with my other hand. Contraction of the triceps and extension elbow should be seen. After that, I move to the lower extremity. I checked the knee jerk reflex first. I told the patient to sit up and let his legs hang freely. Then I stroke the quadriceps tendon ankle reflex. I hold the relaxed foot with one hand and strike the Achilles tendon and noted the palmar flexion. Babinski plantar reflex. I run the reflex hammer up on the lateral aspect of the foot from heel to big toe. I was checking for the plantar flexion. Sensation examination. I was testing pain, touch, position, and vibration. First of all, I checked pain sensation. I started the upper extremities and I moved downwards, touching patient with sharp and dull object and letting them distinguish. Touch sensation, I asked patient to close their eyes and I touched them with a cotton ball across all over the body. I asked them to say now if they felt it. For position sense, I asked patient to close their eyes and move their toe in all four directions and told them what direction am I moving, and then I repeated the same thing at the upper extremity. Vibration sense, I tested on bony spots. First of all, I tested on proximal extremities. I asked patient to close their eyes. I placed it over distal pharyngeal joint on finger and asked them to let me know when it stops. Then I did the same thing on the toes. I was checking sterognosia. I asked the patient to close their eyes and gave the patient a coin and told them to identify what I gave them. Then I was checking for graphesthesia. I drew a number on the patient's palm facing them and told them to close their eyes and identify the number. For 2-point discrimination, I told them to close their eyes and I touched the patient's finger with 2 sets of pins at the same time. The patient should be able to distinguish if it's 1 or 2 places. Then I start decreasing the distance between 2 points until they feel 1 point. For point localization, I told patient to close their eyes and I poked them on the random spot on the body. Then I told them to open their eyes and tell me where did I poke them. Point-to-point movement, finger to nose test. I hold index finger in front of the patient and ask the patient to touch my index finger and their nose rapidly back and forth. Then I ask him to close his eyes and continue in this. Heel to shin test. I asked patient to lay down and told the patient to place heel on the opposite knee and run down the heel. I told him to keep repeating with open eyes first, then with closed eyes. Then I repeated it on the other side. I did the rapid alternating movement test. I asked the patient to move the palm forward and back rapidly. For first past pointing test, while his eyes are open, I asked the patient to stretch their arm up and bring it back down while connecting with my fingers repeatedly. Then I asked the patient to close the eyes and keep doing that. For gait assessment, I asked the patient to walk across the room. I was looking at the posture of the body, arm swinging, movement, and leg or gait abnormality. Then I asked the patient to walk from heel to toe in a straight line. I was observing if there is any gait abnormality. Then I asked the patient to walk on a heel, which tests dorsiflexion and balance. Then I asked the patient to walk on toes, which tests plantar flexion and balance. Romberg test for position sense. I asked patient to stand with feet together with arms on their side, first with eyes open. I asked patient to remain balanced for approximately 20 to 30 seconds. Then I told him to close his eyes and assessed. Pronator drift test. I told patient to stand with the feet apart and I told him to hold his arms straight out in front of him with the palms facing up, and I asked the patient to remain in this position with closed eyes for 20 to 30 seconds. And I pressed on one palm briskly and pushed down, and the patient's arm should go back in the position once I let go. Lastly, I asked the patient to hop on one leg, then the other leg. I noted the posture and balance. After that, I asked the patient to do shallow knee bend.